So today I would like to talk about my topic is exploring the older adults adoption of a telemental health TMH perceptions, influencing factors and challenges. And here is some definition for the TMH because it is designed to enhance access to the mental health care, usually through the e-health computer-driven, followed by health smart device-driven, telemonitoring, remote signals, telephones and video teleconferencing. So there are some studies prove that the effectiveness of a TMH in mental health care. So like behavioral activations therapies and problem-solving therapies are effectively in reducing depressive symptoms and improving the social engagement. It enhances access to care through the digital and remote solutions. It has a greater patents, certifications, and participants in the social roles. However, the digital device among the elder population in healthcare settings significantly impairs their ability to access, understand, and act on essential healthcare information, creating major challenges in the TMH. So the main research question for this study is that what are the older adults' perception of TMH? What further influence their willingness to adopt TMH? And third one is what are the challenges? So the main argument about the perception is that among the elder population, they have like positive and negative perception for TMH. They consider in the perspective of a positive perception, they think it reduce TMH reduce the travel abundance and offering flexible schedulings, and also enhance therapeutic relations and a care continuity. And it reduced anxiety, depressions, loneliness, and improve the emotional support and mood. And finally, it increased autonomy, plus self-management, independence, and the cognitive abilities like the memories and the reasoning. However, there are some negative perception for this. They consider there are some skepticism about virtual care matching in-person quality, and also limited digital literacy and inefficient technological support deter the adoption. In the perspective of the providers, they recognize the TMH's utility, but face a challenge in engaging older adults unfamiliar with the digital tools. They emphasize the culturally sensitive communication and a user-friendly platform designed to foster trust. And about the factors, there are several key predators like to decide whether there or will be the factors that older population want to use TMH or not. The first is the perceived usefulness. That is a belief that TMH improve the health outcome. And also after expectations, that is whether it is easier to use or not. And social influence and the physician's recommendation is that whether they are trust in the professional endorsement brought the adoption. The fourth one is the perceived security and computer accessing. That is addressing the fear about the privacy and the technology. And finally, it's a facilitating condition whether they have a reliable internet, affordable device, and technical assistance. And there are some limited adoption. That is some unsuitable for new payments, either for like private space or complex case, and in effectiveness for the therapists, requiring the physical presence and difficulties observing nonverbal cues. The third one is a concern about managing the emotion in the virtual setting without in-person clinic, clin, clinical support, clinician support. And the next slide is about challenges. So the first is the demographic and contextual barriers, like limited access to the device and the broadband, like limited use of internet for health communication, exacerbates disparities in access to the reliable like mental health information and difficulties with basic digital tasks such as sending emails or navigating the websites, like miscommunication or disengagement due to unfamiliar with like a Telemental platform, and also decreased sensory perceptions, cognitive challenges, and aging-related impairments hinder the technology use. And for the elder population, they prefer to like face-to-face healthcare. That is, they have like their own like cultural and generational expectation. Also, the design and usability challenge would be like complex navigation systems, small fonts, and in-depth technical support discourage adoption, and poor accessibility features often fail to accommodate the sensory and cognitive needs for the older adults. And they also consider the thing they also consider about privacy and security concerns. There are some fears of a confidentiality branch and the stigma around surrounding the mental health conditions. The lack of they think the like unlike would be like lack of a transparency regarding the data collections and the storage processing create a distrust. So in this research, I learned that future research should also focus on the development of a user-centered design that popularizes simplicity, accessibility, and inclusivity for elder adults, like interdisciplinary approach that integrates technology with geo autonomy could yield valuable insight into how to optimize TMH service for elder users. However, long-term studies exploring the effects of digital literacy training on TMH adoption and engagement could provide actionable strategies for stakeholders.